this week, we've been talking about better bodies, and of course, we all want that $1 million smile, and there's so many options out there when it comes to teeth whitening, it really can kind of become confusing. Dr. Rebecca Pitts joins us now to talk about what you need to look for. And first off, we're going to talk about over-the-counter products, because that's what we see, of course, the most often, and usually it's the least expensive method as well. Talk to us first about these different products you can stick on your teeth. I guess you can use little brushes to put them on your teeth. Do any of these really work?
To a certain degree, they do. And like you said, it's very cost-effective, and it won't work to the same degree as what you will get professionally. However, it does work. Now, there are certain things that you have to be concerned about. For example, you should get a consultation with your dentist first to do an exam to make sure that you don't have active decay or periodontal disease, because those products can get into those areas and cause some extreme tooth sensitivity.
Oh, I bet. Now, what about what kind of things you should avoid? Is there anything specifically on packaging that you should look for, and that should be a warning sign to you that this might not be a good product for you?
Yes, the most important thing is making sure that the pH of the product is at least 7 or higher, which means that it's not acidic. Certain products has phosphoric acid or ascorbic acid in it, and that actually etches the enamel and ruins the surface of the enamel. Once the enamel becomes porous from acid etching, it will always attract more stain. So you will always get stain on your teeth, even though in the beginning it gets nice and white, but from there on, always stain.
And that's what you're trying to avoid, so
exactly.
It kind of defeats the purpose of getting the whitener in the first place. So what should you look for? What are things that would be good? You said obviously pH 7, no lower than 7, right?
Correct.
What other things should you look for?
Products that are individually wrapped for each application is better than the product that has just one container, because once you open the container, the oxygen reacts with the peroxide in the material, in the tube, and then it becomes ineffective. So it's better to have smaller, individually wrapped packages, and then each time you use, you open a new one.
All right, I got to ask you about the toothpaste, because you know they have all these different whitening toothpastes out there. Now, I remember when I was in high school, I used to use the Pearl Drops. Do you remember those?
Yes.
So do any of these toothpastes work? Quickly, just kind of break that down for us.
A lot of these toothpaste whiten from abrasive, not so much from the chemical agent that will make the teeth whiter, unlike the whitening products.
Okay, so that could, of course, again, cause sensitivity.
Yes, and also wear the enamel.
All right, not good. Okay, we're going to talk about the procedures you can get done in the dentist's office when we come back. Again, we're with Dr. Rebecca Pitts. We'll be right back. Welcome back. We're talking better bodies, and of course your smile is a very important part of that. Dr. Rebecca Pitts is here this morning to talk to us about some of the different things we can do to make our smile a little brighter. And there are a couple of procedures that you can have done at the dentist's office that you guys can perform to make us look much better, isn't there?
Yes. Generally, there are 2 types of dentist prescribed whitening procedures. One is done in the office, and the other one is where we make trays for you, and then you take it home, and then you put the whitening gel in the tray, and then you wear it for a couple hours a day for 2 to 4 weeks. That's one procedure. And then the other one is where we do it in the office for you, so it gets done within an hour or 2.
And that one's called Zoom, is that right?
Yes, there are many procedures. The one that we have offer in our office is called the Zoom.
And how does that work? We're showing some video, I think, right now of it. How does that work exactly?
Well, it works by using high concentration peroxide material, and at the same time this product has other ingredients to intensify the effectiveness of the product. And the most important thing, I think, is that we have the ability to block out the gum tissue and also the gum recession. So it's very good for people who have gum recession or are prone to getting tooth sensitivity, because it rules out those areas.
Protects those areas, kind of. Okay. And as far as these procedures go, if you're going to have something done in the office or do the trays like that, would those last longer than something that you might buy over the counter at the drugstore?
Generally, yes, because the whiter your teeth gets, that will last longer as well. Now, if you use over-the-counter products, it's only about a tenth of the concentration of the ones that we use.
Gotcha. So you would use a lot stronger products in your office than you would get over the counter. Okay, Dr. Rebecca Pitts, thank you so much for being with us today.
Welcome.
I think Jim's going to come over here and join us real quick because we're going to talk about weather.
I got the 7-day forecast for you, but before, if you're looking for a dentist, I have to say, Rebecca Pitts has got to be the coolest dentist out there.
She's great.
She's got satellite TVs in every individual chair, and when you do those long procedures for some folks who need a little work done, you put on glasses, and she's got DVDs. So it's like really taking a flight across country. So she's in Lake Mary.
Plug,
if you don't mind the drive to Lake Mary, you can head out there. All right, let's check out that 7-day forecast. This is just awesome out there.